I have a question on COVID. Given the new COVID variant, do we expect there'll be another COVID wave this summer?
I hope not. We haven't been advised of that as yet. I suppose we have been told continuously that COVID is not yet gone, and we can see that in our own hospitals that we still have COVID activity, and we have COVID activity in the community. But I suppose the vaccination programme has been very successful, and we don't seem to be seeing patients coming in that are sick, as we would have done during the COVID earlier part of the COVID pandemic. But we haven't been advised as yet. We're following national guidelines. So as soon as we are asked to step up again in terms of putting in any precautions that are required for another variant, we will certainly do that. We have not been advised of anything like that at the moment.
And then I have a question in relation to our vaccination centres, which is kind of linked. Will the work in our vaccination centres cease soon?
No, it's not anticipated that they will cease completely, but they will for the summer be much quieter because at the moment they're vaccinating the older population again, and also the vulnerable patients, vulnerable people. And then in September again, it is anticipated that it will be ramped up. I suppose it's not yet known exactly what will happen in terms of whether there'll be further boosters required or further vaccination requirements. So we'll wait to hear from the National Centre about that.
Okay. Just get a comment there that some people didn't hear the response to the question on working from home, Lorraine, so I might put that to you again, if that's all right. Is there any update on the working from home policy?
Yeah, so this is something that we're awaiting nationally, and we have been told that and again, I hate to put a deadline or a time on it just in case it's not issued in time, but we were told around September time. I suppose they're waiting for the legislation to go through the door for it to be passed in terms of that whole remote working. And I know what we would be looking to embrace the policy of remote working, because I suppose what we've even found from our staff survey that it's something that staff are looking for, and I think lots of organisations are looking at remote working. So it's definitely looking at it and identifying the rules that would be suitable for perhaps hybrid form of working. Yeah.
Okay. And a question on accommodation. Haven't had a question so far on car parking, but on accommodation. Do we have a timeline of when the next group of staff will be moving to Houston Hall? What groups of staff as well?
Yeah, so there's a huge plan done on our review was done on accommodation, and as we know, the demand exceeds the capacity all of the time. And we're hoping, in fact, that once the new working from home policy, that there might be a blended approach to working for some people, that it may be suitable in some departments. And the next move is going to be HR in Houston Hall, and moving from one floor to the top floor, and finance are hopefully moving in June. And other than that, then there's a plan after that. I can't remember the detail of it, but there is a plan to move other staff. So Houston Hall is going to be the next place, and also Sandra from Estates is looking at other possibilities as well, and maybe expansion in areas where we already have staff. So we're always looking at options to try and increase our capacity. And I know, talking about car parking, that the general manager in OSD is also looking at a park and ride system that's going to be maybe extended and expanded for people who are working off-site, so that they don't have to drive to the hospital, that the bus will pick them up for meetings, and that they do that in other hospitals. And I know they do it in the Sales Group from Merlin Park and the University Hospital there, and it works really well. So we're just exploring different options on that at the moment.
Okay. A question about the neonatal unit. When do you expect phase 2 of the neonatal project in the maternity to be complete, and how many extra cots will be added?
There's no extra cots. As the space doesn't allow for extra cots, but we're just starting the project at the moment. They're just starting phase 2, and again, we just need to await the schedule of works, and the timelines will come with that.
Okay.
Yeah, we've just been given approval to go ahead with phase 2, which is really exciting.
Okay. And just coming to the last couple of questions that have been submitted pre the webinar, exactly how many reviews are taking place on the ED?
So at the moment we have the unscheduled care review, which is being undertaken by Deloitte. And then we also have a national specialist group, and that's made up of the special delivery unit, the acute, nationally acutes, and also national community. And we are working, that's a collaborative piece of work that we're doing with them. And that they're also looking at unscheduled care.
Okay.
Yeah.
And the last question we have is there's been, we've seen an increase in media coverage about the reopening of EDs in Nina and Ennis. Is this in the plan?
So in Ennis and Nina, they're part of the small hospital framework. And this has been raised many times. We're very clear ourselves that we do need additional bed capacity in the region. We talked about a hospital for elective patients. And we also need our new 96 bed block, which I spoke about in my presentation. And we're hoping that, that would commence, hopefully this summer. And then but only 50% of those beds would be will be new beds. And then there's a plan for another 96 beds after that. But at this moment in time, there are no plans to, reopen Ennis or Nina in terms of the emergency departments, because I suppose the emergency department is only is only the front door really, and it needs a lot of backup services if you have an emergency department anywhere. And also, this moment in time, if all three of them were open tomorrow, it still wouldn't help, because we just don't have enough beds in the system. So bed capacity is our issue. Most of the patients in the emergency department are admitted patients waiting to be admitted to a bed in either on the UHL site or in one of the three Model 2 hospitals. So it's bed capacity is the issue, more so than the emergency department.
Okay, that's great. That comes to the end of our questions. Thanks everybody who joined us today. For staff who weren't able to join us, we have recorded the webinar and we'll make it available to them in the coming days. Okay,
Thank
you very
you.
much. Thank you.